Today we are going to demonstrate intravenous bolus administration in critical care area. For the procedure, we need to think what are the article is needed. A stainless steel tray containing certain types of articles which is needed to maintain the procedure. A tray containing with all the article, that is a stainless steel tray. It's a containing stainless steel kidney tray for collection of the waste from the procedure. A bowl with a cotton for wiping and for cutting the ampoule purpose. So 50 ml syringe for infusion of anadrophic drugs purpose. So 5 ml of syringe for diluting the medicines from the fluid to injections. This is extension tubes from the 50 ml syringe to patient's IV connection we can use. This is sterile disposal gloves for prevention of infection both from patients as well as the healthcare worker while doing the procedures. And this is for 100 ml NS, we can dilute for most of the ionotrophic drugs in critical care unit. And this is for 25% dextrose. This is also we can use for the most of the ionotrophic drugs to dilutions infusion for the patient purpose. And this is the drugs for calcium gluconate we can use on emergency situations for the critical care unit. It is a 10 ml of 1 ampoule is contained, is a 10% for calcium gluconate. And this is for sterile noradrenaline injections and is 1 ampoule is contained 5 ml, and this is also we can use for the ionotrophic drugs purpose. And this is for 10% dextrose. This fluid also we can use for IV bolus maintenance purpose, we can use along with the ionotrophic drugs. This is IV set we can use to connect the IV bolus bottle to the patient's IV connections. And we can use for the disposal gloves for every movements of the patient's touching and patient care unit. And this is for methyl spirit. It we can use as an anti-disinfectant agent for before doing any procedure, and wiping for the all equipments we can use it. And this is for Bactorab, and it is for the chlorohexidine gluconate we can use for the hand sanitizer purpose. There are two types of bolus administration. One is immediate recovery, another one for the maintenance dose. So immediate recovery purpose we can use एक 100 ml dextrose हम ले रहे हैं, 10 ml को syringe ले रहे हैं and 1 ampoule of calcium gluconate ले रहे हैं. हम इसी को डाइल्यूट करके पेशेंट्स को फास्ट लगाने के लिए हम तैयार करें. अभी पहले सैनिटाइज करें हाथ का. 3 ml लेना है 3 पुश में. फर्स्ट स्टेप हैंड टू हैंड रब. सेकेंड स्टेप लेफ्ट ओवर द राइट, राइट ओवर द लेफ्ट. थर्ड स्टेप इंटरलैसिंग. फोर्थ स्टेप इंटरलॉकिंग. Vice versa we have to do. Finger rotations, vice versa we have to do. Finger clips in palm of the both hand, rotate and backward rotations. Then wrist cleaning, 7th step. Any procedure we are doing before, we have to do the hand sanitizer proper way. That is for the 30 seconds and it should be get it dry. Now she can wear for the gloves before doing the procedure. First 30 ml with the 1 calcium gluconate we are going to administer. We can take dextrose 100 ml, 1 calcium gluconate ampoule we can take, 10 ml of syringe, kidney tray for collection of the waste, cotton we can use for collection of the sharp item. She can start to cut the ampoule of calcium gluconate. After breaking the ampoule, she can withdraw the injection in the syringe. She can take 10 ml of dextrose from the dextrose 100 ml. Then she can dilute for the 10 ml of calcium gluconate in dextrose. So now she will taking 10 ml, we are going to administer 10 ml of calcium gluconate in 100 ml of dextrose. So she is withdrawing 10 ml of solution from the dextrose. Discard in kidney tray. Now she can take calcium gluconate 10 ml. She can withdraw from the ampoule. After the vial should be goes to kidney tray. Now inject 10 ml of calcium gluconate in 90 ml of dextrose. So now she can inject the 10 ml of calcium gluconate in 90 ml of dextrose. Now the dilution of solution is ready. We are going to administer for the patients. Now she can inject in intravenous IV set. Now she can able to display for the sticker. 10 ml of calcium gluconate, 90 ml of dextrose over 30 minutes. So she can write it in the bottle at the time. At 6 o'clock. It is very important, so anybody can come and see and what is going on. It is easily visible to observe. The bottle label must be there in any inotropic drugs. Now we can start for the drugs. So before connecting the tube, we have to check any air inside the tubes or not. If any air is there, we can let out the air out first. Then after air let out, we can connect IV tube into the patient's IV cannula site. This drugs will be administered very slow and we have to move according to 1.5 ml per minute it has to go. So according to that we have to adjust for the drop factors. 1 ml equal to 15 drops for the adult. So we are going to give for the patients 1.5 ml per minute means we have to improve 45 drops per minute. We have to flow, keep for slow maintenance of the dose. So now she is adjusting. Again till that dose is completing she can do for hand sanitizing. Again she can take 3 ml and should apply all over the hand. 7 steps of hand washing she can do it. After the procedure she can do. Every procedure has certain waste generation of each procedure. For according to this procedure, certain waste will be generated. This waste also, because biomedical waste, it is a very dangerous. So we have to discard according to the color code of biomedical waste. So first one is the syringe wrappers. It has to go general blue pen. Cotton, it has to go yellow bin. And needle has to go white bin. Syringe is a plastic, it has to go red bin. And IV cannula wrappers, it goes to blue bin. This is also needle cap and IV cap, it's a plastic, has to go red bin. And ampoule shisha, it goes for blue bin. And after that they should be do it, all the article should be clean and wipe and disinfect and kept in the patient utility room. The nurse also will be discard their gloves in red bin after the procedure. After that they can do for the hand wash. 7 steps should be follow and should be do it in 30 seconds and it will be get it dry for after doing the hand sanitizing.